A lot of Canadians consider themselves lucky because they don't have to pay every time they see a doctor or buy expensive insurance just so they can. But going to the pharmacy, that's another story. So why doesn't universal healthcare include prescription drugs in Canada? On a per-person basis, Canadians spend the second most on prescriptions in the world. A survey found that about a quarter of households had a hard time paying for their medications. The government helps some groups pay for their drugs: Indigenous people, seniors, residents of Quebec, those on welfare, and as of 2018, people under 25 in Ontario. Some people have a drug plan through work, but others pay out of pocket, and that can be expensive. This all makes Canada a bit of an outlier. Every developed country in the world that has a universal healthcare system also has universal drug coverage, except for Canada. Whether it's birth control pills and inhalers, antibiotics, or heart medication, countries like Australia, France, Britain, New Zealand all pay for their citizens' meds through a state drug plan. That was supposed to be the case for Canada too. Pharmacare, or universal drug coverage, was part of the original blueprint for universal healthcare more than 50 years ago. The idea was that every single prescription drug was supposed to cost Canadians just $1. That never happened. Today, Canadians pay among the highest prices in the world for medication. So it's no surprise that the provinces and the feds aren't exactly rushing to pay for everyone's medicine. It would cost billions. But experts say if governments had the monopoly on drug plans, they could also cut the cost of drugs by billions. How? By negotiating lower drug prices with companies. That's exactly what New Zealand did in 1993. Today, New Zealand, some drugs are as much as 90% cheaper than they are in Canada, even Canadian-made drugs. For example, this drug used to treat high blood pressure and angina costs just $11 a year. In Canada, it's 12 times that. Today, for every dollar that Canada pays for commonly prescribed drugs, New Zealand pays just 11 cents. As you might guess, the pharmaceutical industry doesn't like this idea. In fact, Pfizer, the world's largest drug company, accused government drug plans of freeloading off countries like the US that pay the true cost of developing life-saving medication. The pharmaceutical industry also points out that government drug plans don't pay for a lot of prescriptions that private plans do. As for universal drug coverage coming to Canada, it's kind of stuck in a chicken and egg scenario. Governments aren't keen to pay for everyone's drugs as long as prices are so high, but prices aren't likely to come down unless governments use their clout to get a better deal. Want to learn more about drug spending in Canada and around the world? Check out our sources below.